Okay, hi everybody. Dr. Anderson here from Anderson Center, from Anderson Podiatry Center, but also Anderson Center for Regenerative Medicine. We've been doing regenerative medicine for, gosh, I think it's about 11 years right now. And so I have with me Rebecca, who had this done about 6 weeks ago.
Yes.
Right? And really bad heel pain, right? And so I'm holding a piece of paper here. And this is kind of cool because when she came in, her measurement was about, and this is actually it's a scoring system we use, and we rate how severe your heel pain is by how thick your fascia presents on ultrasound. And there's lots of science to this. So the more severe it is, the more difficult it might be to get rid of the problem of the plantar fascia non-surgically. So it's really important sometimes for people to understand the severity. And hers was, you can't read it, but just trust me, she was pretty bad. The measurement normally should be about 4 millimeters, and she's up higher than 7, close to 8. So about double normal thickness. So anyway, I'll be talking to her right now. I just want her to explain, because she's 6 weeks out from having a placenta cell injection. That's what we used, is placenta cell. We didn't use her blood, we didn't use her bone marrow. We used to do that years ago, but we've gone over to placenta cell. So if she could just share with us real quick what it was like before you came in.
So before I came in, I had ceased doing all my weight-bearing activities to include walking, weightlifting, anything in the gym that required weight on my right heel. The only thing I was doing was swimming, and I was even very guarded about pushing off the wall with the right heel as well, because and even getting out of the pool, because it would produce so much pain for me. It was worrisome to me because it had been going on for about 6 months, and I couldn't, and it had just basically ground my activity level to a halt.
You said you even had to walk on grass.
Yes.
You didn't want to walk, you avoided
I would
concrete.
walk on the grass instead of the sidewalk because of the less impact, and very short walks with my tiny little dog. It was all I could tolerate. And even that, I would pay for it the next day.
Okay.
So I came in and had the stem cell injection and the custom orthotics, and I'm 6 weeks out, and I would rate myself as being 40% better. I'm back to being able to walk my dog, walk on the sidewalk. My tolerance level is increasing week by week, and I'm back to playing golf, which I was
awesome.
Worried I wasn't going to be able to do this summer.
Nice.
And so I feel like I'm regaining my mobility,
Right.
which is really nice because
Right.
it's summer and I want to be out doing things. So
And the interesting thing, if I can interject here, Rebecca, is that her, she was really engineering her life around her heel pain, and some of you listening might be in that situation. But then we have other people that just kind of, I don't know how they do it sometimes, they just kind of bear right through it. And so she's doing exceptionally well. 40%, we've had people better than you sooner, but 40% compared to where you are, and the fact that you're able to do stuff now. You weren't able to do anything.
no.
And that equates into it like really nice. So I think you're doing really awesome. And the other thing I want to interject is I always tell people you're going to reach close to your maximum improvement about 3 to 4 months out. So guys, if you're listening, just know that probably 90% of your improvement is going to be behind you when you're out about 3 to 4 months. It doesn't mean you can't improve some more, but a lot of it's behind you, and she's halfway there. So maybe we'll do it in another interview when she gets out there.
Sounds good.
So I guess that's it. Was it painful or anything? Just for people, I think it kind of scares them. It's like, what's going to happen? Is it going to be painful? What's the layup like?
No, the pain block is very effective.
Okay.
It's it's very tolerable. It's not as terrible as people might think.
Okay.
It's well worth doing it so that you can go back to your life and not look for the closest parking spot to the front of the door of a store. I was
Right.
even doing that.
Oh, really?
Yeah, and the thought of going and hoofing through Target was like, no.
No way, huh?
So-
Yikes. Well, that's
So,
great
yeah.
story. So, but no, as you mentioned the numbing process,
Yes.
know that we just don't walk in the room and poke you with a needle.
No.
We actually do it from the side. We numb the area above, well, kind of the ankle area. We numb the main nerves above the bottom of the foot. So most people don't even feel the injection. And then we use an ultrasound. In fact, there's some other videos on YouTube, I think, that you can look up if you're watching, that actually shows the actual procedure.
Mhm.
And we are able to visualize the fascia and then position the injection right where it should be going into the fascia as we do it. So, all right, but thank you so much. You've been a great patient to work with. I'm really happy you're doing well. And
Thank you.
You did a great job.
Yes. Thank you.
So thanks for sharing that, because a lot of people, I think a lot of times people don't know that this is an option that they have. And plantar fasciitis is such a problem,
Yes.
and a lot of people have it. So thanks again.
Yes.
And thank you for watching. Don't forget, please think about subscribing. I always forget to mention, subscribe to our YouTube channel. If you like this, make some comments, share it with other people. I'm always wanting to have any questions you might answer, maybe some things we didn't cover, and we would gladly answer that for you. So thank you for watching.